And while there's really this amazing research happening across the country, across the world, as we saw in COVID, about how to make new discoveries and new therapeutics and how to improve health, we haven't made those same advances when it comes to women's health. When we talk about gaps in knowledge about where women's health has remained stagnant, I can give you several examples. When we talk something about preeclampsia, we've recently seen very unfortunate deaths from athletic Olympic stars who died from preeclampsia in her home. That was from preeclampsia. If you ask me why that happened, there are a lot of different reasons. But when we talk about preeclampsia and we think about 100 years ago, when we first found out what it was and how we treated it, the answer to cure preeclampsia was delivery. In 2023, hundreds of years later, the answer is only delivery. We've made really no advances in understanding the biology of pregnancy, what leads to adverse pregnancy outcomes, from fetal death and stillbirth to preeclampsia to preterm birth. But it's not just pregnancy, which is obviously a unique condition. It's all of women's health. I could talk to you about menopause, which almost the entire female population will suffer from. And yet we don't know why women experience the symptoms they do. We don't understand what brain fog is or why there's cognitive decline. I could go on and talk about endometriosis, a condition where the lining of the uterus literally grows outside of the uterus and affects 1 in 10 women, causing chronic pain, infertility, and so many different symptoms. We've made no advancement in that. So when someone asks me about why do we need a Dean of Women's Health Research, I can give you a million reasons why. And they all focus on making improvements in understanding the biology that drives female and sex-specific disorders, as well as improving the therapeutics so that women actually can have better health outcomes.